You know, these days, you're hard-pressed to meet someone whose life has not been touched by cancer. Consider this statistic. A report from the Institute of Medicine states that by 2030, new cancer diagnoses are expected to reach 2.3 million per year as our nation's population ages. That's about 700,000 more cancer diagnoses than we will make this year in 2015. Yet, there is promising news. So, the 5-year survival rate for all cancers from 2004 to 2010 was 68%. That's nearly 20% better than it was in the mid-1970s. Indeed, people with cancer are living longer thanks to groundbreaking research. And among the organizations at the forefront of this research is Memorial Sloan Kettering Cancer Center in New York City, the oldest, the largest private cancer center in the world, and perhaps the most respected organization in terms of commitment to quality and innovation. Today, we are very excited to welcome several executives and physician leaders from Memorial Sloan Kettering to the Lehigh Valley Health Network for a very special and exciting announcement. To make that announcement, I am honored to introduce to you the President and Chief Executive Officer of Memorial Sloan Kettering, Dr. Craig Thompson.
And it's an enormously exciting day for all of us as we announce that the Lehigh Valley Health Network will become the newest member of MSK's Cancer Alliance. For the last 130 years, Memorial Sloan Kettering has been a single-purpose hospital dedicated to understanding and developing innovation that will help patients with a diagnosis of cancer. Our goal has been to detect cancer at its earliest stages, develop novel therapies, which are, as Brian just said, accelerating today, and increasingly develop therapies that have less invasive effects on their patients, so the patient's quality of life, whether they're cured or they're able to live with cancer as a chronic disease, is more effective. Today, cancer has become, as Brian just said, a treatable disease, and more oncologists practice in a community setting, and it's possible now to deliver world-class care well outside the original confines that we imagined as a research hospital 130 years when Memorial was started. Today, more than 80% of patients receive their cancer treatment in their local community. MSK Cancer Alliance was born out of our desire to advance the quality of care and improve the lives of cancer patients and their families in their own communities. We want to bring the latest treatments to patients outside of New York City at an accelerated pace. In establishing this alliance, both MSK and LVHN will carry out collaborative efforts. This is a two-way street. We're going to learn from each other. We're going to develop best practices that can be adopted anywhere, and we're really looking forward to that. And it will deliver improved care for patients and enhance cancer research at both organizations. As LVHN becomes a member of MSK's Cancer Alliance, patients will benefit from expanded access to Memorial Sloan Kettering's clinical trials and to the latest discoveries in cancer research.
Many of you are familiar with the concept of clinical trials, but I'd like just to spend a little bit on what a clinical trial is. Clinical trial is an exercise, is an effort by which new therapies are being tested in patients with cancer. There's been a lot of misconceptions about trials in the past, whether they are useful to patients or not. All this now is totally being clarified to everybody. Patients that participate in clinical trials to date have a very high chance from benefiting from these therapies. In the coming months, teams of physicians and other healthcare providers, both from Memorial Sloan Kettering and LVHN, will be working side by side, involved in a rigorous process to look at resources, capabilities, and also to make sure that we develop, as I mentioned before, our standards of care. Once the review process is complete and the Lehigh Valley Health Network becomes an official member of the MSK Cancer Alliance, we will begin collecting and tracking data on quality of care, on outcomes, and patient satisfaction.
It took a great deal of hard work to get where we are today. The process to prove LVHN as a worthy member of the MSK Cancer Alliance has been and continues to be the most intense our cancer program has ever experienced. Now we're driven to take our care to the next level so the people of our community can have access to the best cancer care in the world right here where they live. Here's what this alliance will mean for patients. You'll gradually have access to more than 800 clinical trials currently available at MSK. For instance, now we have 100. You'll receive personalized medicine, a model in which the patients and their tumors' unique genetic makeup is analyzed in more and more sophisticated processes to determine the best treatment for their cancer. LVHN physicians will collaborate with their MSK partners and physicians who have experience in treating all these different types of cancers, including rare cancers. Together, this is bidirectional, will determine the therapy that will be the most effective in the community where the patients live. As this knowledge is shared between MSK, LVHN, and the other future organizations that will join the alliance, we'll quickly make the latest, most effective cancer treatments available to the people of our community. And that's the bottom line, providing more hope and better outcomes for our patients.
At LVHN, we've been caring for our community for nearly 120 years. As our relationship with MSK begins, we'll continue to do so with even deeper knowledge and deeper expertise now. This collaboration will bring evidence-based, world-class standards to our entire health network. Most importantly, it will save lives.